my name is Jim, and I am a placement student here at APAA. And we have just done a presentation in celebration of the Black History Month. And a colleague and I talked about why Black History Month is celebrated. It's a time for reflection and to remember that Black people in our community have contributed to the Canadian society. We also introduced several prominent figures in Black history in Canada, and to remember our strength and the achievement that our people have achieved in Canada. We also have a very inspiring conversation about anti-oppression and anti-racism for Black people and the importance of solidarity and allyship. That's it. I think what we've talked that's very important in our conversation is that that the system is very oppressive for a lot of people, especially CB communities, and that's why we have to stand up and fight. On the other hand, it's also very important to have allies like myself, who is not from the ACB community, with more people from marginalized communities like Indigenous people, other people of color. If we stand together, then we have a greater chance of overcoming the systemic racism in our society. And that way, everybody would be able to be equal someday and live an equitable life.
My name is Pascal Diade. I'm a senior epidemiologist and biostatistician at Public Health Agency of Canada, and also I'm a part-time assistant professor at McMaster University. I was invited today by APAA to talk about HIV self-testing. It was a pleasure to have a turnout. More than 30 people show up, and they were so excited about about these new tools to test for HIV. So basically, I introduced the HIV in Canada, the estimate from 2020, and then I move into talking about the benefit of self-testing, the way around stigma, and giving the opportunity to underprivileged population and key population, to be able to test themselves as much as they want, and that for sure will improve the number of people who know their status and link them to care and prevent, the downside of AIDS. And that's very important, because the early you get linked to care, the better is the HIV treatment, and by the end, you have the viral suppression, right? So I think it was a good. I also talk about the INSTI, from Bioanalytica. That's the only HIV self-test kit in Canada right now. It was approved on November 3rd, 2020. And I think it's a great tool. We also saw a small video, a demo on how the test could be used and when a test is positive or negative. And also we talk about, what to do when the test is negative. You can get linked into PrEP, and if the test is positive, there's a way to get an antigen, more sensitive test to get confirmation, and also to get counseling and get linked to care, right? So, but again, it's a great tool. HIV self-testing is a great tool for those who, because of so many reasons, do not have the chance to get tested.
My name is Johannes Yelio. I am the HIV prevention coordinator and strategy worker at APAA, Africans in Partnership Against AIDS. Here we are at APAA at 526 Richmond Street, finishing up our Black History Month event for 2023. It was an amazing event. We had a really great turnout of our volunteers, community members, and supporters. It was an amazing event. So we organized a Black History Month event to celebrate our achievement as Black community members, and also discuss some of the issues that are affecting us. And our topic for this year was HIV self-testing. Student placements from APAA, they did a presentation around Black History Month. chronicling what Black people have been doing in Canada, and also featuring some notable personalities within the Black African communities in Canada. And it was really interesting to learn the achievements of Black communities in Canada. And we get a feedback from many of the participants that it was motivating them to do much more in Canada in their new home. And apart from that, we have a presentation from Dr. Pascal from Public Health Agency of Canada, and also he's a professor at McMaster University. And his presentation was focused on HIV self-testing. As you all know, right now you can do HIV testing from the comfort of your own place, or from the place of your choice, and you don't have to go to a hospital or a clinic or service provider. You can do it wherever you want, you choose to do it, and that's called HIV self-testing. So Dr. Pascal's presentation really dissects into why we need to do HIV self-testing, what are the procedures, and also what are the costs related to it, and where people can access it. And there are so many interesting discussions around it about, you know, access to care after the HIV self-testing, and also, you know, other related issues including PrEP and PEP. So it was a very interesting discussion for many of us. We learned a lot about you know, knowing our status, how it helps us to protect for ourselves and then the entire community from HIV, and also connect people to care to HIV in a timely manner. And I would like to take this moment to thank everybody at APAA, all staff at members at APAA, and the organizing committee, Mr. Kasao, Anna, myself, and every one of our students, placement here, and volunteers for their contributions. It was a very, very successful event, and then we're still trying to see the evaluations that we received from our participants, but we'd like to thank everybody that participated. And also I just want to take a moment to thank Starbucks Canada, the one located at Yonge and Dundas, Dundas Square, providing us free coffee for this event, and it was a great contribution by them. I would like to thank the store manager and the staff members there for their support. And anytime you need HIV, AIDS, or sexual health related information, you can contact APAA